that mammogram saves anyone's life. All evidence to the contrary, mammogram costs lives. It causes more people to be diagnosed. It is causing some breast cancers, and it is leading to overdiagnosis. The Women's Health Initiative set out intentionally to literally, quote unquote, end the runaway train of hormone replacement. And when you think about it, estrogen causes breast cancer, and no one with hormone positive breast cancer should take hormones. And yet they give them tamoxifen, which is a synthetic estrogen. So synthetic estrogen is okay, but bioidentical estrogen is not, right? Like, duh, makes no sense.
Welcome back to another episode of Healthy Rebels, and I'm your host, Bonni London. And my goal is to empower you with the knowledge to take ownership over your own health. And today is no different. And I am so excited and honored to have Dr. Jenn Simmons here, who is a pioneer and an expert in breast cancer treatment, joining us for this important conversation. Because I just want to mention that 1 in 8 women in the United States will develop invasive breast cancer in their lifetime. And not only is the statistics alarming, but what's even more concerning, which is what we are going to talk about today, is the widespread misinformation that exists around this disease. So welcome, Dr. Simmons.
Thank you. I'm so happy to be here with you and to talk about this topic that has been central and paramount to my entire life. So, people ask me all the time how I got into this. Quite frankly, I didn't get into this. This got into me. I was born in a breast cancer family. There's never been a time in my life where I remember not knowing about breast cancer. I mean, it's part of the tapestry of our family. So that's my dog, Teddy, just getting his 2 cents in. So, as you said, breast cancer is going to affect 1 in 8 women over their lifetime. And even that statistic doesn't really reflect what's going on, because the truth is that you can be one of those 8 women, or you can be the daughter of one of those 8 women. You can be the sister of one of those 8 women. You could be the cousin of one of those 8 women, the friend of one of those 8 women. So it's really affecting all of us. And it's the reason why we need to understand what breast cancer is, understand what it isn't, because we have a whole epidemic of overdiagnosis and overtreatment. So there are so many people that are affected by this disease that don't even need to be affected by this disease. And so it's so important to know what breast cancer is, what breast cancer isn't, how we can prevent it, how we should be screening for it, all the things that I know that we're going to talk about today. It's just a
Yeah.
really important conversation to have.
Well, yeah, well, let's begin. I am interested also for you to share a little bit of your personal story, because you started out doing surgery,
Yeah, I
and
did.
how you transition to really getting behind the scenes, and how
Yeah.
did this all change for you?
So again, I really don't remember a time where I didn't know about breast cancer or what breast cancer was. And when I was a child, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was beautiful, brilliant, larger than life, literally lit up a room when she walked in. She wrote 54 hits. Can you imagine how prolific that is? She wrote 54 hits in all. And her most famous song was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986, when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks on the top of the charts. I mean, there was literally not a person on earth who didn't know that song and know every word. And unfortunately, my cousin Linda would never know the success of that song because she died 1 month after Whitney released it. 1 month.
Oh my God.
I was 16 years old when my hero died. And her life and ultimately her death gave birth to my life's purpose. And I did the only thing I knew how to do so that no other woman, no other family, no other community would have to suffer the way that mine suffered. So I became a doctor. I became the first physician in my family. I became the first fellowship trained breast surgeon in Philadelphia. I became the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I was about 15 years into my career, arguably at the top of the world. I'm running the cancer program for my hospital. I'm running the Department of Breast Surgery. I'm a wife and a mother and an athlete and a philanthropist, and I have all these balls in the air. And I go from being probably one of the most high-performing people there are to I can't walk across the room because I don't have the breath in my body. And I spend a really intense 3 days being completely worked up from head to toe. And at the end of those 3 days, I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemoradiation, and I'm going to be on lifelong medication. And despite the fact that these are things that I said all day, every day to people without hesitation or reservation, when these words are coming to you, it has different meaning.
And what
And
was
I
what
still,
was the diagnosis?
I had thyroid cancer. I originally had Graves' disease and then later thyroid cancer. Now, I don't know to this day because know that I was very deeply entrenched in conventional medicine. I'm running a cancer program. I'm telling people to have surgery and chemotherapy and radiation all day, every day, and without a second thought, without worrying about it, without being concerned that maybe I'm not doing the right thing. Never did I have that feeling until it was my turn. And when it was my turn, call it God, call it universe, call it whatever you want to call it, I kept getting a message in my brain, there's something more, go find it. There's something more, go find it. And I left the office that day. I refused treatment. My doctor, who is my friend, told me that I was going to die, that that this will that I cannot reverse this any other way. And it's not that I didn't believe him. It's just that I could not wrap my head around God giving me such a vital organ because our thyroid gland is the center of our metabolism. I mean, you literally cannot live without it, right? And I couldn't wrap my head around God giving me such an organ only for me to remove it and have to be on lifelong thyroid hormone replacement. Just didn't make sense. Like, why should I be putting something else in my body when my body should be able to do that? And so I went home and started to do research. Now, this was 2016, and Dr. Google was far more reliable than Dr. Google is now. And I kept seeing references to nutrition over and over and over again. Now, as a traditionally trained physician, we get 15 hours worth of education around nutrition in our very first year of medical school, and then never again. Literally never again.
And it's
And
from 1985, I would add.
yeah,
Yeah.
yeah, yeah,
Mhm.
exactly.
Oh,
And so I knew that I needed more education there, but I was still conflicted in that I wasn't overweight. So I thought, like, I'm not overweight. I went to medical school. I must know enough about nutrition. So I have this whole like back and forth with myself, and I decide to enter into a certificate program called the Institute for Integrative Nutrition. And I'm sitting in one of those very first lectures, and this tall, lanky guy with this big toothy grin comes on the stage, and he introduces himself as a functional medicine physician. Now, at this point, I'm a doctor for about 20 years, and there I am, my snooty booty self, sitting in the seat saying, there's no such thing as a functional medicine physician. Like, what is this quack talking about? And then I remember that I'm sick and I'm there for a reason. So I check my ego at the door and I tune in, and thank God I did. Because the quack, as it turns out, was Dr. Mark Hyman. And what he was going to say over the next 2 or 3 hours was literally telescoping not only how I was going to heal, but how I was going to help the universe heal from breast cancer. Because what I learned in that space and time is that in conventional medicine, our focus is all wrong. We're focused on the symptom. We're focused on symptom alleviation. And
That's right.
we're not focused on healing. We're not focused on disease reversal. We're focused on symptoms. And in the area of cancer, the tumor is the symptom, but the tumor is not the problem. It's the symptom of the problem. So if all you're doing is focusing on the tumor, you're never going to positively affect the trajectory of the rest of that person's life. And I knew if I was really going to make the impact that I wanted to make in the area of breast cancer, not only did I need to learn how to be a healer, because I thought I was a healer before, but I was wrong. So I needed to learn how to be a healer. And then I needed to set myself on a course to heal people. So I enrolled in the Institute for Functional Medicine. So at one time, I'm full-time in surgery, full-time in IIN, full-time in IFM. I spend the next 3 years just submerged in the study of functional medicine. And when I came out, it was a bell I couldn't unring. I just knew that this has to be about healing for people, because if we don't help people heal, we're never going to change things ever. So that's my story.
I'm speechless. No, seriously, that is
Have
an
you really never heard it before? I
obvious.
feel like I feel like we know each other so well, but I guess not.
Apparently, I have not heard that story, and no, it is very powerful, and obviously a lot of physicians who are in functional medicine now, for sure, echo similar
Yeah, there's
stories.
a lot of pain to purpose out there, a lot.
Yeah, yeah, no, it is amazing. Well, but I think that is really important. So yes, so what is breast cancer? What is breast
Yeah.
cancer? I thought I knew what it was, but apparently I need help on this one too.
Well, I think that there's so much misunderstanding about there, because so many people think that breast cancer is some foreign invader or something that, doesn't belong. And I get that, right? It's unwanted, certainly, but breast cancer is a part of you. It's the part of you that's saying, this isn't working, whatever the this is for you. Because cancer is a normal response to an abnormal environment. And it's whatever is creating that environmental shift that deserves our focus, that needs our focus. So,
Excuse me, but I really want to highlight your quote from your fantastic book about how breast cancer is the canary in the coal mine, because I think that's what you are kind of speaking to now. And so,
yeah,
yeah, explain that.
yeah. So, and it's not just the breast, it's the thyroid too.
Sure.
And what's happening is that when we are exposed to all of these environmental toxins, our bodies are inherently smart. They know that they need to protect us from these toxins. So what do? They store them away in areas where they think that that is the safest place to put it. And in general, where we store our toxins, because most toxins are fat soluble, where we
Mhm.
store our toxins are organs where we have significant amounts of fat. So when we talk about the breast, even if you have dense breasts, the breast is made up of four tissues. It's made up of glandular tissue, fat, connective tissue, and a skin. It's all held together in a skin envelope. And I don't care if you have the densest breast there are, you still have an abundance of fat cells in your breast. And that is where our toxins are being stored. Now, think about what life is like when you're living next to a hoarder. When the person next door to you is just holding on to all of those toxic things, eventually they're going to run out of space and start to spill over onto your lawn. This is what's happening in the breast. The breast neighbors are hoarders. So these breast cells are being exposed to these toxins because they're sitting next door to them. And what's happening is those toxins are causing DNA damage in the cells, in the breast cells. So when that happens, we have these damaged cells that are living in this toxic environment, swimming in this toxic soup. They just go into survival mode. That's what's happening. They go into survival mode. Reproduce, 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 reproduce. It's scary out here. We just need to make sure we're staying alive. We don't have to do it right. We don't have to do it well. Just reproduce, reproduce, reproduce. And that's what's happening. And the truth is that our lifestyle, as it has evolved, we are less active. We get more toxins. We have more toxic exposures. And so those toxins are just sitting there. We're not moving enough. We're wearing these compressive garments. Like, ladies, I'm sorry, you got to let them go. You just have to. Like,
Let
you
the
have
babies breathe. That's what we say.
let them breathe, let them go, let them move, you know?
Well,
And
Well, it brings up, to me, a big topic that comes up that won't die is about the people thinking the genetics and the BRCA test. And you know this much better than me, but even though the test was not around, let's say in the 1920s, 100 years ago, we had far less breast cancer. So those same
yeah.
genetics are obviously working very differently at play in 2024.
Yeah. So our genetics have not changed, right? Like for thousands and thousands of years, humans look exactly like they look. And that's because our genetics haven't changed. We
Mhm.
have not, our genetics are not changing. The thing that's changing is our environment. So are there some people's genetics that make them more predisposed to getting breast cancer? Yes. Are there people with BRCA mutations, with PALB mutations, with KRAS mutations? Yes. Yes, these things exist for sure. And those people are at higher risk. But those people, even the people with genetic mutations, they don't 100% get breast cancer. There's not 100% penetrance, even with those high risk genes, which incidentally, those genes are tumor suppressor genes. So if you are born with a defect in one of those genes, it means that you're not as good at fighting off cancers, at DNA repair, because we all make cancer cells from the very young to the very old, everyone in between. We all make cancer cells. And it's just a matter of if our body is prepared, is going to recognize them, is going to correct them in their infancy before they become a mass or a tumor or something like that. So there is definitely, without question, something else at play. It's not genetics alone, it's the environment. It is absolutely the environment. So your genes and your makeup and how you detoxify and what allopathic load you're going to be able to tolerate, that is all your genetics and that is all very real. But you still have control for the most part over your environment. And there are so many choices that we can all make every single day to help to shape our environment to promote health rather than disease.
Well, well, you speak my message obviously with diet. So I think that, I mean, you think about the biggest lever that we can pull, would you not agree that that would be top on the list? And
100%.
and along those lines, I really would like to ask you, because I get this question myself as a dietitian about red meat and isn't it dangerous? And I think about breast cancer and this plant-based vegan narrative and all of the toxins in these meat alternatives and what is going on here. I know
Okay.
I just put a lot out there for
You
you to
did. You
respond
did.
to.
So let's first talk about where the meat thing came from, because the studies on meat eaters, in general, when you look at people who eat meat, they also eat other things that are toxic.
Yes.
That's what's happening. We don't have any controlled studies of people who eat like vegetables, fruit, and meat, and that's it, right? So I can't tell you if you're someone who's eating clean and including lean and clean meats in your diet, if you're going to be at increased risk. I can tell you that if you're including bacon and pork and commercially raised chicken and commercially raised beef, these are very inflammatory foods. And they are, without question, going to increase your risk of malignancy because they are pro-inflammatory, because they lead to free radical damage in your body. And eventually, we will run out of bandwidth to be able to deal with the free radicals. And for the most part, if you are someone who has a meat-centric diet, you're probably not getting enough antioxidants in your diet, because the antioxidants are not coming from the meat. The antioxidants are coming from the colorful plant foods. Now, on the other side of it are the vegans. So these are people who like never meat. And so they're eating these frankenfoods, these impossible burgers and beyond meat and garbage. It's garbage, right?
There's
So
not
I
the
think,
soy, and you think about soy and cancer, which is a big thing, but then this is genetically modified soy that's been processed
yes,
with pesticides
yes.
and
So like
chemicals and all of that.
if you're eating non-processed, non-GMO soy, if you're eating edamame beans, great, because we know that that has tremendous benefit for you. But as long as you tolerate soy, which
Yeah,
is a
good
tricky
idea.
protein for some people.
Yes.
Um, but that is a far cry from your protein shake, which is made up of soy protein isolate, right? Like these things are not the same. They're not the same. And from me, from a dietary standpoint, I think that we should all be eating things in their original form, things that came from the earth, that came from God, that is what we're supposed to eat. And all of these processed foods, I don't care how pretty the label is, I don't care how clean they say the ingredients are. Processed food is processed food, and our bodies don't know what that is. The same evolutionary patterns that we were talking about, where breast cancer is not a genetic disease, food intolerance is not a genetic disease, in that we are just not meant to eat processed food. So people are getting into so much trouble with gut health because they're eating things that our bodies do not recognize as food. So for many, many years, and please know that I am plant-based. I think that everyone is bio-individual. I think that it's not for everyone, and it is not easy, especially at my age, which, I'm just going to out myself to say that I'm going to be 56 in 2 months. So, especially at my age, it is not easy to be solely plant-based because you really, really struggle with protein, and you have to get enough protein to maintain your metabolism and to maintain your muscle mass. So it's not easy. And there shouldn't be anyone who is solely plant-based who's not supplementing, because you need B12, you need vitamin A. Not everyone converts it well from beta carotene. So there are definite deficiencies in the diet if you do not have some form of animal protein. And so you can supplement your way around that, but it takes a real commitment. Takes a real commitment. And in
So,
the long run, there will be some degree of frailty.
so you
Yeah,
I'm sorry. Well, no, you spoke quite a bit about the certainly the environmental toxins, which we know is huge. But, and to me, this is also very important with the diet. And what I see going on still is we know the connection between insulin and cancer, and of course, sugar. So again, getting back to, the higher carbohydrate and the how all of this breaks down and then triggers insulin and that connection that can be
for sure.
driving the
But
cancer.
that's for people who are plant-based and including grains. So for me, I think that everyone should be on an unprocessed whole food diet. I also think everyone should be on a grain-free diet. I do not believe in grains. Grains are the seeds of grass. Grasses are meant to be eaten by ruminators. Ruminators like cows and horses.
I have four stomachs.
Yes, they have completely different digestive tracts than we do.
Right. We
And they
cannot
are
digest
meant
this
to
stuff.
pass the things back and forth, back and forth, back and forth. And that's because it takes that much to be able to extract the nutrient from there. If we as humans never ate another grain again, we would suffer no nutritional deficiency, nothing. There is nothing that we need from grains ever. And so, from my perspective, if we don't need it, if it's not doing anything for us, why would we include that in our diet? There's no benefit there, none.
Yeah,
So I don't believe
I
in grains. So what I advocate for is a whole food, plant-based, low glycemic, grain-free diet. And where you get your protein is where you get your protein. Like, I'm not interested in this religious war between the vegans and the carnivores. Like, I'm just not interested in it. For my own practice and for my own work, when people come to me with a breast cancer diagnosis, I put everyone on a whole food, grain-free, low glycemic vegan diet for 3 months because I want to detox them. I want them to get a lot of nutrient, a lot of antioxidant in, and I want to try to detox them. And then if we transition to wherever they are, wherever they feel comfortable, if they want to be a pescatarian, okay. If they want to include animals, I have rules about those animals that you include because you're not, I don't know if you have this supermarket, but like you're not buying meat and poultry from the Acme because that is garbage. It's garbage. If I met someone whose family is in the chicken business, and she said, if your family were in the chicken business, you would never eat another chicken ever again. The conditions in which they're raised are deplorable. It is disgusting. It's disgusting. And so if you are buying conventionally raised poultry, conventionally raised meat, these are really inflammatory foods and they are going to lead to disease states. So unfortunately, I think in this day and age, we have to be so, so, so careful about what we're choosing to put in our body because, as you mentioned, what we eat and drink is our biggest exposure to the outside world. You think about the gut as being an internal organ, it's not. The gut is an external organ. It is communicating with the outside world every single second of the day with what you eat and what you drink.
well, I love this. This is fantastic, but I am sure you are aware that many still oncologists will tell their patients to eat as many calories, as much ice cream, as much Ensure shakes. I had someone walk out of my office saying, "You're not telling me what my doctor told me."
Yeah, it's a
And
huge
and and
problem.
it's a big problem.
I agree.
It's
And it's
and
it's a
listen,
big problem for so many reasons. You alluded to it to start. First of all, insulin. is a growth hormone, and insulin is what we secrete in response to glucose in our blood. So, and it's actually a really smart program in that when your tongue tastes sweet, and we get that sweetness from sugar, from honey, from syrup, from juice, from anything that's made from a pulverized grain. So, if you're eating bread, the finish on that bread is always sweet because it's immediately converted to glucose.
Oh, yeah.
And so whenever we get that glucose signal, we secrete insulin. And just after that, we secrete insulin like growth factor. These are growth factors. The reason that people gain weight is because we're heavy on the insulin and heavy on the insulin like growth factor. And this signal to the body is store, 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 right? And so we're making fat cells and making fat cells and making fat cells. And with regard to people who are going through cancer treatment, this is a disaster. Because if you're trying to get rid of a tumor, if you're trying to get rid of uncontrolled growth, and yet the hormone signal in your body is saying, grow, 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 this is a terrible mixed message, right? So
Well,
the last thing you want to do, first of all, if you are undergoing chemotherapy, you don't want to even eat. Chemotherapy should be given in a fasted state. The work of Walter Longo at USC with his fasting mimicking diet shows that there is tremendous benefit to fasting, doing a 72-hour fast in and around chemotherapy, 2 days before the day of chemotherapy, so that you're going into chemotherapy in a fasted state. That whole thing about you shouldn't lose weight while you have cancer, that is such an ignorant statement. And it's born out of a complete misunderstanding because there are people with very advanced cancers who are in this hypermetabolic state and they have cachexia. So these people what's happened is that the cancer metabolism has taken over and it's using all of your fuel to grow. Most people are not in that position. That is an absolute minority and a very end stage finding of cancer.
mhm.
Most women who get breast cancer, certainly not all, I'm not making a generalization here, but most women who get breast cancer are overweight and would benefit tremendously by losing weight and getting to their ideal body weight. So the information that the medical oncologists are giving people, no matter what you do, don't lose weight, eat pizza, eat ice cream, drink Ensure, it is just, it's horrible, horrible advice. And it really
Yes,
doesn't serve people, it hurts people.
I couldn't agree more, but I thank you. So now I want to turn to another very hot topic that I tell you, not a week goes by that this discussion does not come up. And that, depending if you've had a diagnosis or if you have a risk factor for it, and that would be hormone replacement therapy.
I love this topic.
Okay,
There's
well, I am so happy.
So listen, I finished my training in 2003, right with the release of the Women's Health Initiative. And I was trained by a brilliant, brilliant man. His name was Gordon Schwartz. He was an international authority in the area of breast cancer. And when the Women's Health Initiative came out in 2003, he said to me that there are only 3 things that you need to know about hormone replacement. It causes breast cancer. The only people that should take it are people that absolutely positively cannot live without it. And if you do prescribe for said people, it should be the smallest amount for the shortest amount of time. And that is literally how I went through almost 20 years of my career. And then I did not go quietly into my good night. And when when perimenopause hit me, I had brain fog. I would walk into a room 10 times and not remember why I went, and walked out and remembered and walked back in and couldn't remember and walked back out again. I had dizziness. I had palpitations. My hair was falling out. I had dry skin. My joints ached. I would wake up in the morning with swollen hands. I literally had a 10-pound weight gain, like out of nowhere, where I was fit my whole life. I suddenly had a belly. I literally had every single negative symptom that is associated with menopause. And I couldn't go on. I mean, I was evil to my family. Everyone was like, oh my God, get away from her. My relationship was suffering. My everything was suffering. And I was so fortunate to speak to someone who we know well, and Deb Matthew, who is in a mastermind with us. She had just reviewed all of the data from the Women's Health Initiative, and she said to me, can I come on your summit and talk about all of this information? And I was like, I mean, yeah, sure, but I don't know that it's going to do any good because, hormones cause breast cancer. And she's like, actually, they don't. And she came on my summit, and for an hour, I sat there like this. So like here I am literally at the end of my rope, and I happen to be talking to Deb Matthew, who is a physician in North Carolina and an authority in the area of hormones. And she had just reviewed all of the information from the Women's Health Initiative. And she said to me, Jenn, I was running a summit at the time. And she said, Jenn, can I come on your summit and talk about hormone replacement? And I'm like, well, you can, but it's a breast cancer summit and hormones cause breast cancer. So I don't know how comfortable I am. And she's like, no, they don't. And you have to hear this. So she comes on and she literally talks for an hour. My jaw is on the floor. Like I'm just sitting there the whole time, taking it all in. I'm flabbergasted by this. And at the end, she tells me that I need to read this book, Estrogen Matters by Avram Blooming. So I get this book and I read it, and it blows my mind. Blows my mind. Here's what I learned. The Women's Health Initiative set out intentionally to literally, quote unquote, end the runaway train of hormone replacement. And when you think about it, why would the pharmaceutical companies want to give one medicine when they can give 9 or 10? So let me give you some examples. If you are suffering from all of those symptoms that I was suffering from, and let me tell you, I had huge workups because people didn't talk about palpitations being part of menopause. So I had a $5,000 cardiology workup. People didn't talk about dizziness being a part of menopause. So I had a $3,600 MRI of my brain because I thought I had a brain tumor. People don't talk about all of these changes. So, if you're not on hormone replacement, you're taking an SSRI for depression, you're taking an anxiolytic for anxiety, you're taking a sleeping med because you can't sleep, you're taking beta blockers because you're having palpitations. You're also probably accelerating your heart disease, and your cholesterol is going up. So they're going to put you on a statin. You're having gut problems and reflux. So they're going to put you on an acid blocker. They told you to get a DEXA scan and your bones are thinning. So now they want you to take a bisphosphonate. Every time you laugh or sneeze, you pee because you're losing the strength in your pelvic floor because that's what estrogen does for you. So now they want you on an alpha blocker to try to help with that. And on and on and on it goes. And this is what the pharmaceutical companies wanted. And I get it, but it's not good for us. Not good for us at
Well, you
all.
just explained at least half of the patients that come and see me or more that are
Yeah.
all on the same 10 medications.
Yes. Yes. That's
That
exactly right.
that that
And that's why they're on them. And they don't work. They don't work. Nothing. And they actually said in the study, why should we give hormone replacement when we have SSRIs and statins and beta blockers and they literally said
and
this.
wasn't it done on people like you said purposely? They were already past menopause. They used
The average age was 63. These women were done.
and also
There was so much of it that was inappropriate. First of all, they said that they were healthy women. Half of them had a history of smoking. They were on hypertensive. They were on cholesterol medications. I mean, the bottom line is it's very hard to be healthy when you're 10 years out from menopause and you haven't had estrogen, because estrogen is the key to life. And when you stop having significant levels of circulating estrogen, and I want to be clear, I put people on hormone replacement. I put breast cancer patients on hormone replacement, but I am not trying to restore premenopausal hormone levels. That is never a goal of mine. My goal is to keep them out of adult diapers, out of wheelchairs, and out of nursing homes. That's what I'm trying to do. I'm trying to prevent dementia. I'm trying to prevent incontinence, and I'm trying to prevent fractures. That's what I'm trying to do. And at the
explain
same time, protect their heart health, protect their metabolism, allow them to continue to have bone strength and muscle strength and joint health. I mean, these things are all really important, but I'm not trying to make them have a baby at 70,
there's
right? Like, that's
no,
not my goal.
but also speaking to the fear of the bioidentical versus the synthetic. And then I know this isn't your area, but it makes me crazy because I feel like there's so much questions about that. And then they think nothing of giving the synthetic like birth control to everyone for
Yeah.
forever.
So for me, that's a really big problem because the synthetics are synthetic. So I think about it in the breast cancer realm. It's so funny that they say that estrogen causes breast cancer and no one with hormone positive breast cancer should take hormones. And yet they give them tamoxifen, which is a synthetic estrogen. So synthetic estrogen is okay, but bioidentical estrogen is not, right? Like, duh, makes no sense. Then we on the other hand say you shouldn't be on bioidentical hormones because they're not controlled and they're not this and they're not that. However, let's give you conjugated equine estrogen, which has like, I don't remember if it's 30 or 60 estrogens that we don't have in our body. So it is so crazy to me. And even with that, the ladies that took that as compared to the ladies that took nothing did better. So even synthetic estrogen is better than no estrogen at all. But it, we have to at some point be intuitive, be logical, and say, we should only be putting in our body the things that our body understands. Now, with hormone replacement, I do have a couple more rules. I only use bioidentical. I never give oral estrogen because it's inflammatory. When it goes through first pass metabolism in the liver, it's inflammatory. I don't give oral testosterone for the same thing. Progesterone's okay. I don't do pellets because pellets often end up overdosing people and people are super therapeutic. We don't want that. We are not trying to overdose people. We are trying to give them the minimum amount to prevent symptoms and prevent degeneration. That's our goal. And when we look at the population of women who have had breast cancer and go on hormone replacement, they do not have an increase in recurrence and they have better long-term outcomes. Same thing on the other side of it. For the women that take hormone replacement, if they get breast cancer, because quite honestly, let's face it, if you take hormone replacement, you could get breast cancer. If you don't take hormone replacement, you can get breast cancer, right? So, but if you are on hormone replacement and you get breast cancer, you have a better prognosis. You have a better outcome. So we're really doing people a great disservice by not prepping them when they're in their 40s about perimenopause, about the symptoms of hormone depletion, and getting them started on hormone replacement as soon as they start to develop symptoms. Because we should be doing everything we can do to preserve people's health. And this is how we're going to do it. And we need to train way more hormone literate providers, way more. There's still way too many people out there who believe the findings of the Women's Health Initiative, even though the retraction paper published in 2017, which like 3 people read. And even though we're talking about it more, the training still isn't there in medical schools. It still isn't there in advanced nursing programs. It's just not there. It's not there. So we need to train people better. We need to be better providers. And we need to help people to be healthy, because that is what's going to make the difference in the long run. Because we all want to live as long as possible and die young.
I love this. You gave so much in there that was amazing. All right, so I have a question that's actually 2 in 1, but they're kind of connected, because I know there's a lot of talk about alcohol, wine, and breast cancer. And then it's just making me think of the other aspect of this, which is the stress we're under and the mind-body connection. So,
Mhm.
so how do we put this together? I know they're kind
Yeah.
of 2 questions.
So,
If you hear me though.
but this is how we put it together, because the truth is that we are living in stressful times, right? We are overburdened in more ways than we have ever been before. People have more responsibility, they have less time, they're doing more, they are more available. You know, every single person is walking
Ding,
around
ding.
with one of these.
I mean, during this column, ding, 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 you know?
Yeah, well, I turn mine off. But the bottom line is that we are more stressed than ever. And now more than ever, we need to have safe, effective ways of managing that stress.
Mhm.
And up until very recently, alcohol was people's number one way of managing the stress. You would come home from a stressful day at work and pour yourself a glass of wine or have a martini, or you would get the kids to bed, and your reward for getting the kids to bed was to have a drink. And I hear this time and time and time again. And when you do that, just so you know, there is no safe amount of alcohol for women. And the reason is because as women, we have a lot of hormones more than men, and we have to detoxify those hormones. That happens in the liver. If you are drinking alcohol, it takes 8 hours to detoxify an ounce of alcohol. So if your liver is busy working on that alcohol, it is not working on detoxifying your hormones. And before long, you're going to get into a hormone imbalance state. So this is why alcohol is such a problem with regard to breast cancer, because it completely throws off your estrogen metabolism and detoxification. So listen, don't shoot the messenger. And I, I I love a martini as much as anyone. However, I don't love how I feel the next day. And I have gotten to the point where it's not it's not enough for me for that feeling in the moment to make up for what I feel the next day. So for me, it's just not important enough to me to do it anymore. But if you are drinking, first of all, if you have active breast cancer, there is absolutely no room for alcohol in your life at this time. So please, please, please do whatever you can do to get alcohol out of your life. If you are not actively cancering and you're healthy, Is an occasional glass of wine or occasional cocktail going to change things for you? Probably not, but I wouldn't drink on consecutive days and I wouldn't have more than one drink because it really does significantly affect a lot of things. If nothing else, think about how you sleep on the night that you drink alcohol, because you're probably waking up between 2 and 3 in the morning. And that's the time where your liver is saying, hey, I'm supposed to be doing something else right now, and you have me clearing out all of this alcohol. Don't do this to me, right? Like your sleep is awful when you drink. So it's all of these things that we need to think about. And the truth is that the stress isn't going anywhere. Alcohol and pills are not the answer. We all need to develop a skill set where we have safe and effective and healthy ways of dealing with stress. So maybe you're going to learn to meditate, or maybe you're going to do yoga, or maybe you're going to be like my friend Marcel Pick and become a ballroom dancer. I don't know. I don't know what it is for you,
What do
but
you
whatever it is, pick it, work it. Maybe have more than one tool in your toolbox. Maybe you like to do deep breathing. That's a great skill that you can do literally anywhere and at any time. You know, if someone cuts you off in traffic, 4-7-8 breathing goes a long way, a long way. So I think we all need to build our toolbox. I think we all need to build our skill set. And we cannot rely on things like alcohol and pot and drugs to help us cope with the stressors of life. It just doesn't work.
Yeah, and then my favorite tool of the past 5 years has been the sauna. I don't know what you
So
think.
sauna is amazing because it serves so many purposes and it checks so many boxes because you get all of that detoxification in there. So you're getting rid of all of those environmental toxins. If you have a red light in there too, amazing. And it is time for you to sit and reflect and be quiet and meditate and breathe and allow your brain to detoxify. I mean, hopefully you're not in there on the phone or the iPad or whatever. So if you are in there in stillness, in allowing your brain to download and detoxify and, you know, taking that time to meditate and breathe and all that, it's amazing. It's amazing. It goes a really long way.
I love it. Okay, so finally, I have probably one of the most important questions here today is regarding testing. And I know you have a lot to say, and I really want to talk about this. So tell me about.
A lot to say about everything, I think.
I think we covered everything, but this is really huge.
Yeah. So listen, people are really uncomfortable with not screening for breast cancer. And I get it, right? Because it's hugely prevalent and people want to screen for breast cancer. But we have a very broken screening system right now because right now the screening system for breast cancer is mammogram. And despite the slogan that mammograms save lives, it's just simply not true. And it's been proven to not be true time and time again in huge, huge population studies. So the mammographic screening program, which set out in the 1970s, did have the best of intentions. And it was built on this foundational understanding that breast cancer growth was both linear and predictable. So that the understanding was that breast cancer started small, grew to some critical size, at which point it would be more likely to metastasize. So if you found it anywhere before that critical mass, you could save lives, decrease the amount of treatment people got, and save breasts. And it's a lovely, logical theory, just doesn't happen to be true. Because breast cancers are what they are from the beginning. So if it's an aggressive process, it's an aggressive process from the very beginning. If it's going to be systemic, it's going to be systemic from the very beginning. So it doesn't matter if you find it tiny, that course has already been predetermined. And we know this to be true because no matter how many mammograms we do every year, the same exact number of women die of breast cancer. And the only thing that goes up with the more mammograms we do is the incidence of breast cancer. We diagnose more people, right? And partially that's because a mammogram, let's face it, is radiation. If
Hmm.
we called it what it was, if we didn't call it a mammogram, lovely name, picture of the breast, right? If we called it what it is, a breast x-ray, then everyone would register in their head, hey, this is an x-ray, it's radiation. In every other realm, in every other sphere, we know that x-rays and radiation causes cancer. We know it's a known carcinogen, and yet we allow the exception for a mammogram. It's a mammogram, safe, right? And when we look at the large population studies, when we look at the Canadian breast cancer screening trial, which is a trial of 90,000 women, 45,000 were screened with mammogram, 45,000 were just examined every year by their physician. The survival from breast cancer is exactly the same between the two groups. Exactly the same. The same number of women are present with aggressive disease, and the same number of women die of breast cancer. What's different? The incidence of breast cancer, because there are 20 to 30% more breast cancers in the group that we screen with mammogram. 20 to 30%, meaning that we are treating 20 to 30% more people for breast cancer that do not need to be treated, that would have never progressed to become clinical disease. They did not need that treatment. And if breast cancer treatment were benign, that would be one thing. But breast cancer treatment is quite dangerous. Breast cancer treatment, almost everyone who goes through breast cancer treatment is made menopausal, whether you were before or not. And it accelerates heart disease. It accelerates bone loss. It accelerates brain degeneration. It affects your psyche, your sexuality. It affects your relationship. It affects you financially. It affects you from a time perspective, and on and on and on. And there are some very serious ramifications, like if you're treated for breast cancer, you are 2 to 3 times more likely to die of cardiovascular disease than if you're not.
So
We already
you're saying
exponentially
that
die of
people,
cardiovascular disease.
so the same potential number had cancer, but because it showed up in the mammogram, they got treated where the other ones didn't. So
That's
they did have cancer, but that it didn't help them survive. I'm just trying to understand all
right.
the numbers you're saying.
So when we look at autopsy studies, there are a considerable amount of people that die with a cancer in their body that didn't die of the cancer, right?
Gotcha.
So we're all making cancer cells, but not all of them come to fruition. And I think the takeaway here, and this was again repeated in the Swedish studies of 600,000 women with the same exact finding. So I don't think our purpose is to find breast cancers. I think our purpose is to identify who does and doesn't need to be treated. And that we can get from if you present with clinical symptoms, if you have an active lesion. So mammogram has no way of determining that. And we have to be honest, mammogram is causing some of those breast cancers. I can't say how many, but if you radiate the breast tissue every year, year in, year out for 20 years, you're going to cause some breast cancers. You're actually going to be the reason why someone gets a diagnosis. We cannot, it's immoral. It is immoral to take a healthy woman, because that's what the screening population is. We're talking about healthy women. It is immoral to take a healthy woman and expose her to radiation unnecessarily. We're not talking about the high risk population. We're talking about you're 40, welcome to the screening world. Get a mammogram, right? No one's
The
asking.
pressure is incredible. The pressure to get, getting them every
Well,
year.
that's exactly right, because what is the number one way that hospitals make money? Their cancer
Uh,
programs.
okay, well, you do have a better solution for us.
I do. I do. So I want to talk about what I think everyone should be doing because I think that's important. I
Yes.
think absolutely everyone should be doing self-examinations because no one is ever going to know you better than you know yourself. So when you know what your breasts feel like and when you know what your breasts look like, you can detect when something's changed and something's different. So I think everyone should be doing self breast examinations. If you are premenopausal, you should be doing them 1 week after your period starts, so day 7 or day 8. If you are postmenopausal, do it the first of the month. Do it whenever you regularly do something else so that you remember. But self-breast examination, from my perspective, is really important. And then if you have the opportunity to be near a center that uses QT technology, this is really forever changing how we are going to screen for breast cancer. So what QT does is it is circumferential sound waves transmitted through a water bath. So the breast is submerged in water. Circumferential sound waves that create a three-dimensional true reconstruction of the breast that has 40 times the resolution of MRI, 40 times. So,
For
but
people
that's
also with dense breasts as well. That for me has been a
it's
huge.
for dense breasts, it's for people with breast implants, because when you put a breast implant in, you kind of push down all of the breast tissue and you essentially give them dense breasts. So, and it can also detect implant integrity. So, but that is not even the most meaningful part of this technology. Yes, it's 100% safe. Yes, it's accurate. Yes, it's fast. Yes, it's comfortable. Yes, it's affordable. Like all of that. Yes, that's true.
No radiation, obviously.
No radiation. But the most important part of this technology is that it has functional capability. And what I mean by that is it actually measures the volume of the breast. So you can image someone and see something, even if it is a cancer, you can have them come back for a short interval study and re-image the breast and measure the volume and measure a doubling time. And we know that cancers have a doubling time of less than 100 days. And things that are either not cancer or not active, not meaningful, have a greater doubling time. So if you see someone and they have a doubling time of less than 100 days, you know that is the person that needs to be treated. And in that instance, that risk benefit ratio falls on the side of benefit from treatment. But if you have someone who does not have an active lesion, whose doubling time is 200 days, you just tell that person to come back in a year and see what happens. Because that person does not need intervention. That person does not need treatment. What they need is an ability to tap into how do they get healthier. This is opportunity. This is how do you dial in your diet? How do you get your movement right? How do you prioritize sleep? How do you detoxify your environment? How do you take the trash out, right? And how do you live your life with purpose? Because what's happening in your breast, again, this is the canary in the coal mine. This is your breast telling you if it's working for you or if it's not. And if it's not, we are giving you the opportunity to change it.
And it's earlier too, the detection on this machine.
Well, I mean, sometimes it is and sometimes it isn't, in that if you're going to have an aggressive process, that's going to happen quickly. So those people, no screening is helping those people. The people with aggressive processes, no kind of screening is helping those people. But what this kind of screening does, and what I am on a mission to eliminate, is it's eliminating unnecessary testing. It's eliminating over testing. It's eliminating over biopsy, because people are getting biopsied left and right. Every time people see something in the breast, they send these people for a biopsy. And once you've been biopsied, it's a bell you can't unring. You think you're high risk. It's awful. It's awful what we do to these people in the long run.
It's
So
traumatizing.
it's traumatizing.
Oh yeah.
beyond any of the physical parts of doing it, beyond the numbing and the gun and the this and the that.
Mental. Yeah,
It's
terrible.
traumatizing. So, but the most important part that we need to pay attention to, that we need to get rid of, that we need to change, is we need to get rid of overdiagnosis and overtreatment. Because when you diagnose a woman with breast cancer, you forever change her life and not for the good. And if she does not need to be treated for that breast cancer and you treat her, you are decreasing the quality and the duration of her life. And this is not right. And for all of those people out there who tell me that mammograms save their lives, and I'm glad their lives are saved, believe me, but I'm not at all convinced that mammogram saves anyone's life. All evidence to the contrary, mammogram costs lives. It causes more people to be diagnosed. It is causing some breast cancers, and it is leading to overdiagnosis. And people, if you get treated for breast cancer, develop heart disease, and die of heart disease, that death gets attributed to heart disease. And nowhere does anyone trace it back to the fact that you probably would have never had the heart disease, but for the breast cancer treatment.
Well, that being said, so what is your stance on treatment now, assuming someone needs to be treated? What
Yeah.
is your
So if you need to be treated, your proverbial bucket is overflowing, right? You need to clean up. You need to clean up the flood on the floor. So that's surgery, that's radiation, that's chemotherapy. I believe in all of these things if you are in crisis.
right?
If you're not in crisis, that's the main part of my book. You have time. You have time. You have time to figure out what is that environmental shift? What is that chemical shift? What is creating that the insult to the canary in your coal mine, right? What
Yeah.
is creating that environmental shift? And let's take the time to reverse that. Because if you can get sick, you can get well.
Oh, wow. I love that. And I think that's a good time to end this. This has been fantastic. Now, and this device is approved by the FDA.
It is. It's FDA cleared because devices are cleared and drugs are approved.
Oh,
And
okay. Thank
we
you.
are using it at Perfection Imaging in Haverford, Pennsylvania, just outside of Philadelphia. And I will be opening 7 more Perfection Imagings this year. So look out for one in a town near you.
Well,
And
I can't
uh,
wait. I'm
I
getting
hope
in
to
line.
open 50 of them. Yeah.
I
Yeah.
I am getting in line. I am done with the ultrasound and all of that
Yeah.
shenanigans.
I
And,
mean, and I want to be
and
clear,
here
ultrasound,
is
yeah.
Dr. Jenn's book, by the way, here.
Yeah, The Smart Woman's Guide to Breast Cancer, available on Amazon. And if you liked hearing from me, you can check out my podcast. It's called Keeping Abreast with Dr. Jenn. It is available wherever you get your podcasts. I
Great
have a
name.
medical practice. It's called Real Health MD. So if you're looking to work with me, my practice is realhealthmd.com.
And I will
Uh,
put everything in the show notes as well,
yeah,
because it's
yeah,
been,
amazing. And we'll put Perfection Imaging there, and you can just go to perfectionimaging.com, and perfection is spelled with a QT in the middle. So if you want to come and see us and schedule your study, perfectionimaging.com. And then I'm on all the social media outlets at Dr. Jenn Simmons, and my Jen has 2 N's.
love it. Well, thank you so much. This has been awesome. Really, really important. And I hope many people listen and share it with their practitioners, that they'll be on board with them.
That would be good.
I hope so.
That would be really good.
A
Yeah.
lot. Okay.